If you clicked on this video, chances are you may be curious whether you have post-traumatic stress or someone you care about may. So in today's video, I'm going to give you 4 signs that you can use to filter whether I potentially have post-traumatic stress disorder. In my experience, there's an undiagnosed epidemic of PTSD. And the reason it's so important to get the correct diagnosis for that is then I can finally get the correct treatment. Many of my clients have been going for years and decades to physicians, to therapists, holistic practitioners, trying to find out why they have all these different symptoms. And so they get a diagnosis for their different symptom, and then they get some kind of intervention or management of that symptom, but they never get the resolution. You know, they might be diagnosed with depression, so they get put on an SSRI, or they get cognitive behavioral therapy to help manage some of the depressive symptoms, or they get diagnosed with generalized anxiety disorder, and they get prescribed Xanax or Klonopin or Ativan or some benzodiazepine classified drug. On down the line, it could be couples therapy, it could be managing their anger outbursts, but they don't really get a comprehensive view of what is going on in its totality to realize that they have been through some different traumatic events, or maybe they don't deem that they have. You may be suspicious that I have something like post-traumatic stress, but I don't feel like I've been through anything traumatic, so I couldn't have that. And so I want to get into today, again, how to filter and assess whether you have this. And I think in most cases with clients I work with, there's an intuitive sense that they're missing something or something's not right. And so at this point, after seeing so many thousands of people for 15 years, within, I would say, on average, 60 seconds of talking to someone, I can tell whether they have PTSD or not. And a lot of times their reaction is, I knew it. I knew there was something, or maybe I did have that. So the 4 filters I'm going to give you today come from the psychological community about how we assess and diagnose PTSD. The more cutting edge trauma therapists, we use the term post-traumatic stress injury. So, if you got in a car wreck and you broke your leg or had some, severe physical injury, we wouldn't say you have a disorder, we would say you have an injury. So the term disorder for some individuals is fine, for others it can feel very shaming. So the injury term I think is much more de-shaming and appropriate for I've gone through a traumatic event or a series of traumatic events, and now I have a biological injury to my system that is manifesting these symptoms. Hello, my name is John Hawkins Jr. I'm a licensed psychotherapist in the state of Florida, certified trauma specialist, and co-founder of Hawkins Counseling Center. So as I said, today I'm going to give you 4 filters or 4 signs that you have post-traumatic stress injury. So the first would be intrusions. So these things come involuntarily against your will. You're not wanting them, focused on them, but they intrude, like memories of the traumatic incident, dreams about the traumatic incident, physical sensations. You could be, classic things like flashbacks. They could come in different forms. I have other videos where I really explain how post-traumatic stress develops the injury and then how it creates these different symptoms, but they're associated with our 5 senses. So in terms of the flashbacks or intrusions, you could get a physical reaction, you could hear things, smell things that aren't in the present. This is a dissociative process. You were exposed maybe to an external trigger of the traumatic event, and then you're stuck in this state for a prolonged period of time. So these are these intrusive things. And again, this takes place on a continuum. So let's say 1 to 10. So maybe somebody else might have an 8 or 9, you have a 3 or 4, and they get a diagnosis of PTSD. And maybe when you've sought out help, people don't recognize the process of what's happening to you is very similar to somebody who's got an 8 or 9, it's just at a lower level. Then you don't get diagnosed and get the correct treatment. So again, intrusions are the first things that really, again, come involuntarily. That's probably one of the most disruptive parts of post-traumatic injury. The second area is avoidance strategies. So whether it's an internal trigger, an external trigger, examples would be like, I don't want to think about it, talk about it. Maybe others have encouraged you to seek help or get therapy because they see some of the suffering and you're like, no, I don't want therapy, doesn't work, or what good is talking going to do about it? It could be compulsive behaviors like substances, medications that you're using, Even if you're using them appropriately, they're to suppress the trauma, which in acutely is okay, but you want to resolve these things because you do not have to live with post-traumatic stress injury or any kind of traumatic stress response. Could be things like binge eating food, compulsive spending, pornography, sex, compulsive work, where you actually get praised for it, but you're using it to block things I don't want to think about or feel. Sometimes people aren't even conscious of that. Maybe they're cleaning their house, nothing wrong with their house, but they can never sit still. In today's day and age, everybody's on social media, and so their partner oftentimes can feel rejected or abandoned because they can't stop. And then when they try to bring that up, people get defensive, but these are different avoidance strategies. The third area or third sign overall is alterations in cognitions and mood. So, things like challenges with memory. I don't remember a lot of what happened. It's hard for me to remember specific details of the traumatic event, or it could cause disruptions in memory subsequent to the event because your brain can get locked into like a hyper-aroused or hypo-aroused state, and then it's hard to be present and code things in memory. You could have, distorted views or overgeneralized things around people, the world, yourself. So like, I'm worthless, or you can't trust anyone, or the world's an unsafe place, or nothing matters, where those things didn't exist in that way before. So the traumatic event really altered that for you. There can be, really distorted views on the cause, like I shouldn't have gone on that date or wore that dress, or if I just would have done this, or you internalize blame about the trauma. A lot of times you get stuck in these chronic negative states like fear, anger, shame, guilt, and it just becomes really pervasive for you. Then there's, detachment from others, just an unwillingness sometimes to engage in significant events that you used to love prior. Could be socializing, art, music, whatever it was, going out, pursuing fun activities. You just don't feel like doing anything. This is where often you'll get a diagnosis of major depression, but really getting that piece fleshed out of what's causing those depressive symptoms. And then a real challenge to sustain or access positive emotional states can be really challenging because parts of you are stuck and frozen in the trauma, and then your system has either, again, hyper aroused, like in chronic anxiety or hypervigilance or things like that, or is under aroused and what's called hypoarousal. So more of those depressive symptoms, kind of flat, detached, you're disconnected from others, you start isolating yourself, particularly, in some cases, in many cases, to avoid any of those external triggers. Maybe I was in a severe car wreck on the way to work, so I don't like to drive that way now, or I'll, take me twice as long to get there, or I don't even like to be in a car, or maybe I cut off all socializing because it was a relational wound that I experienced. The fourth and final sign is alterations in physiological arousal and reactivity. So these are things like, again, poor concentration, hypervigilance. You could really, your system is really primed, but part of me feels unsafe, which leads to, that classic startle response, those kind of things. In addition, things like, being very reactive, aggressive, angry when there's really not been any significant provocation, but I'm just ready to go. Poor concentration, maybe I'm either shut down or going back to the hypervigilance. It's hard to focus, pay attention, access my more cognitive parts of the brain, what we call executive function. And then a big area, probably everybody who experiences post-traumatic stress injuries, is sleep disturbances. So things like falling asleep, maintaining sleep, like severe insomnia, that just adds to all the stress and the disruption that you're experiencing. So just to review again, these four signs. So the first is intrusions. Remember those things that come against my will, thoughts, images, memories, dreams, body sensations. Second sign was avoidance strategies. So it could be, I don't want to think about it, talk about it. Compulsive behaviors to numb it. Even dissociative parts of your personality can numb or block things to avoid them. The third was alterations in cognitions and mood, like distorted thinking, kind of this global negative pervasiveness, isolation, shutdown, chronic negative moods, inability to access positive states. And the fourth one, again, was alterations in physiological arousal and reactivity. So I hope that's beneficial as a kind of a basic filter to assess whether you might have some level or type of post-traumatic stress injury. Then you can seek out the appropriate help that you need. And so that's the main purpose we put out all our videos at our counseling center, is trying to give you accurate information that can benefit you, that can help with mental health, that can help with trauma. And if you feel like maybe you were watching this video for someone you really cared about, that you could forward it on to them. If you want to learn more about this in more detail or would like some help in healing from post-traumatic stress, you can contact my wife or I, Bissan Hawkins, anytime at hawkinscounselingcenter.com. We'd be more than happy to speak with you, meet with you, or refer you somewhere that could be a benefit to you. So I hope this was informative. Look forward to watching some of our videos on trauma. I'm going to do one specifically on exactly what's going on in the brain and the body and how PTSD develops in the first place.